Hi and welcome back. Today we're going to talk about flu. It has not been at the forefront of our minds in the last 4 years because in the spring of 2020, COVID stepped in and said, hold my beer. But it is re-emerging as COVID is getting less and less severe. So we need to address it. Why is flu important? The reason is, in years past, flu has killed between 40,000 and 80,000 Americans each year. That is double the number of people who die of breast cancer each year. It's a staggering amount for something that really should just be a cold. Also something that is preventable in many cases. Flu often starts with a couple of days of what we call prodrome symptoms, where someone will just feel a little cough and congestion maybe, often a cough that hurts and is really achy in the chest. And then people feel like they got hit by a truck. Almost verbatim, every time when they walk in my office, they'll say that. I have what I like to call the Kale inclusion criteria for flu to help my medical students and I decide if someone has the flu. One is they walk in and say, I feel like I got hit by a truck. 2, if they're wearing their bathrobe into my office. 3, if they're wearing their pajamas in the office. Extra points if they're wearing their bathrobe and their pajamas together. If someone is curled up in the fetal position on the exam table, or if they have a hoodie with the hood pulled over their head and the drawstring pulled so that only this much of their face shows, it's a pretty safe bet that they probably have the flu. In all seriousness though, it's usually a deep cough that hurts, fever, chills, body aches. And people often say they're too sick to come to the doctor's office. So what happens if we believe somebody has the flu? We can do rapid flu tests in the office. They take about 15-20 minutes to run. That's a very useful tool. If someone comes up positive, then we know immediately what they have and the best course of action. If we don't have tests available, we actually can diagnose this clinically. If there's a lot of flu going around and we have a strong clinical judgment that that's what's going on, then we can treat accordingly as well. In some cases, medications are warranted. People who are at high risk, people who are healthcare workers, people who have underlying lung conditions, or who are more at risk of dying because of flu or winding up in the hospital, then we put those people on antiviral medications. The two most commonly used right now are Tamiflu, the generic is oseltamivir, or Xofluza, the generic is baloxavir. Xofluza is newer and prescribers love it because it's one dose. Patients love it too. It's usually pretty clean as far as side effects are considered, and you actually can take it if you're sick with the flu or if you have a known exposure and are at risk for getting the flu. Tamiflu has been on the market quite a bit longer and actually is available as the generic now. It is a course of 5 days, twice a day, and can help shorten the duration of your flu and lessen the severity of your symptoms by as many as 2 days according to literature. You have a 48-hour window to start this medication once your symptoms start. Without the antiviral medicines for flu, it can last 7 to 10 and sometimes 14 days in more severe cases. So, now that you've taken your flu medicine and you're starting to feel better, when can we go back into society at large and not feel like we're at risk of infecting somebody else? Well, one rule of thumb is if you're fever-free for 24 hours without keeping your fever down, then you're probably okay to go back. One of the rules of thumb that I use on myself, because I don't usually run much of a fever, is if I could take a shower and get ready without having to sit down and rest halfway through. It's pretty normal for people to be really tired and draggy for several days. Sometimes you'll even have some brain fog for a few days and just not think as clearly as usual. A few weeks ago, my husband had the flu, shared with permission, by the way, and he almost went to work without pants one morning. A bit about flu shots. It's important if you're in healthcare to get a flu shot every year. We haven't had a flu shot shortage in quite a number of years, so they're widely available to everybody. The goal of getting an immunization is, one, to prevent catching an infection, but the most important reason we give immunizations is to prevent death and hospitalization. So, a lot of times people who get the flu shot say, well, I don't like to take the flu shot because I get the flu when I have it. Well, technically that's not true. What happens is you get a robust immune response. And when your immune system recognizes that little piece of the flu that is in the shot, it sends out all of the same chemicals to fight that it would if you had the flu, which causes muscle aches, maybe a low-grade temperature, and that malaise that we feel, which feels just like the flu. Just imagine how much worse it would be if you actually did catch the flu. So don't be afraid to take your flu shot. So once you're fever-free, feeling better, and remember your pants, you should be safe to go back to work. Thanks for tuning in. Like and subscribe, and stay tuned for COVID.